welcome to this latest edition of the three healthcare headlines you need to know from Tallahassee podcast. I'm super excited, Joe, for today's program for a number of reasons. First of all, we kind of stripped back some of the infrastructure of today's program, given our special guests that we have coming on, and we're not doing formal headlines, so this is kind of a raw edition of our podcast. And also, it happens to be National Margarita Day. So, looking forward to getting through this podcast recording and enjoying a little of my one of my favorite beverages. So, with that, I'll have Joe introduce himself. I'll come back and we'll finalize these introductions and we'll introduce you to our special guest today.
All right. Yeah. Thank you, Fraser. My name is Joe Daraskevich. I work alongside Fraser at several societies and associations across the state of Florida. And each week we get together and kind of talk about some big level headlines over in Tallahassee during the session. And yeah, we're recording early so that we can get out and enjoy Margarita Day today. So, Fraser, go ahead and introduce our special guest.
Yeah, and I have the pleasure of introducing Toni Large this morning. And in my role as executive director of a number of medical societies in the state of Florida, I've worked with Toni for many years, too many that we'll mention by number specifically. But one of the hardest working lobbyists in Tallahassee with a healthcare background. She does a fantastic job for all the organizations she represents on our behalf. She has her own company, Large Strategies. And a lot of what we're going to talk about, hopefully our members have been following along every week during session because she sends out this terrific email at the end of each week, capsulizing everything that's happened that week and kind of looking ahead to what's going to happen the week before us. So we're super excited to have Toni with us. Toni, welcome this morning. Thanks for joining our podcast.
My pleasure. Happy to be here. Happy that we're all the way through to the end of week 6 as well. So we just hit the 40-day mark, which is quite unique. Once you hit the 40th day of session, that means a lot of things change, which means a lot of the House committees, though they'll keep meeting for a few more weeks, a lot of the Senate committees, especially the first committee of reference, like Senate Health Policy, will no longer be meeting. So it definitely kind of helps you zone in on what really is going to pass versus what was filed might have gotten heard in say one committee or no committees at all. Usually good ideas. It's not a reflection many time on whether it was a good idea or not, or whether or not the lobbyist or the association really pushed an issue, just whether the political appetite was there to pass a bill for the session.
And that's why Joe and I were so excited to have you this week, just because, I mean, we're talking heads. We kind of look at what's happening in Tallahassee from afar. You're there in the trenches doing the work every week. So, given where we are in the calendar, it's fantastic to have you with us. Just to give our members an update of what's happened so far and what we're looking ahead for the next few weeks.
Yeah, and I will say too, when you hit the 40th week, the hope is that we're moving towards budget negotiations. So there's less time in the system to hear policy-driven bills and more time's going to be devoted to crafting a budget. Because remember, it's the one thing the legislature has to do before July 1st. For continuity of a fiscal year for the next upcoming fiscal year and to keep the government kind of running. Um, Remember, it's one of the reasons that session lasted for so long last year. So the hope is that they can actually come together and finalize a budget. There's other issues out there that are also kind of threatening to hold the session up. One of the biggest one is property insurance. I know this is a healthcare podcast, but I think all of us probably care about property insurance. All of us would like to see a reduction in that, especially since there's such a disparity across the state. You might live in one county, it's one rate, one price. You live in another, have a similar house, and it could be a totally different rate. So looking at how to rein that back, that does mean local governments, though, will probably feel the effects. The House did pass a property tax proposal just this past week and sent it over to the Senate, but the Senate really doesn't have one right now. So it'll be unique to see if the Senate president, which I did hear him in a press availability just a few days ago, saying that he applauded the House for the steps they took in creating that proposal, but they definitely are going to look to see what their proposal might look like. Of course, it would be a constitutional amendment that would go on the ballot in November for voters to decide. But what's in that, the details, the bones of it would really be set by the legislature. You have, though, a few days before the Senate president came out saying, he applauded the approach or the kind of framework that the House had made. You did hear the budget chief saying, "Oh, we will not be as generous." we will not be as generous. So stay tuned. Like I said, the budget alone might have reason to derail the legislature finishing on time, but I think property taxes have a better chance of derailing an on-time finish.
Yeah, and there's been rumors of the session having to extend because of the budget for a number of years, and here we are just, a few weeks out from the scheduled end of session. I mean, where do you think we are? Can you kind of put a percentage chance on this session getting extended?
I don't, right at this moment, I don't feel like it's going to be for the budget. I do think it would be for property taxes, though. I could be wrong since we just started the House, how it works in the legislature. You have to have a Senate bill, you have to have a House bill. They both have to work their way through the process, and then they have to go and kind of meet up. The budget's a little different in which it's automatically a conference that occurs. So on Thursday, the House passed its budget. On Friday, the Senate passed theirs, and now they'll go into conference. What usually is the biggest sticking point is the amount that the budget's going to be. And I need to look back at my notes, but I think right now the House has $1.9 billion less in their budget versus the Senate. So what that really means is they'll have to compromise on that number. And then also that means the House is asking for bigger cuts in their budget. So the House has lately taken a stance under Speaker Perez that he wants a lean government. He wants one that can stay within its means. So they have, and this was a sticking point last session, that the House wanted to spend less and the Senate had more, whether member projects or just reoccurring projects for dollars. And the governor at the end has the veto power over the budget. He even has line item veto power. So even if things make it through the legislature funded, it's not unlikely for the governor to use his veto pen to even lessen that budget amount even more.
Right. Well, yeah, Tony, it's really exciting to have you on as a guest, and we're going a little off the normal script. Normally, Fraser and I, have three headlines. We talk about them, and we harp on those things. But because we have you, we're going to just ask rapid fire questions and just kind of get your thoughts on all these different things. So, I want to take a look down at the history, and in historical terms. The lack of cohesion between the House, Senate, and governor, is this something that happens often, or are the last 2 years sort of an anomaly? What are your thoughts on kind of how all those different chambers are, working this last couple of years?
I would say personally, I feel like this session they're working together better than last session, but that probably isn't a good benchmark because last session there didn't seem to be any coordination of priorities. I will say though, when you have three different generations in each of those houses or each of those leadership roles, it makes for a unique combination. You have the Senate president who it would be on the older side of elected official. You've got the governor kind of in the middle, and then you got Speaker Perez, who's quite young. Both the governor though and the speaker have young families. I believe the Senate president, already has grandkids. So it's a different way of looking at life and a different way of looking at things. Thankfully, our Senate president is doing better. He had quite a medical event that happened right before session. So that might have kind of slowed down a little bit of what was happening, suffered from, a massive blood clot. I think he's doing better. He's definitely at the Capitol every day, and so he looks good. So I'm glad to hear he's on a mend. And you also have budget chairs that look quite different, and also from different generations. I would attribute a lot of the issues that have gone on in leadership to just that, the different ages that we see, the different generations, the different thought processes. It does, as always, this is traditional though. The Senate tends to be not as conservative as the House. The House, represents smaller districts. The Senate has much larger districts. The House only has 2-year terms. The Senate has 4-year terms. But on top of that, in Florida, we do have term limits. So they only have 8 years to go from a freshman all the way up, in some cases, the Speaker of the House, or a freshman and already being a Senate president. It is a 2-year term in those leadership roles. So the first year tends to be a little bit more rocky than the second year. And we're in that second year. And we're also in a big election year. So stay tuned for that. I think that's also shaping a lot of what they want to do. So there are some big proposals out there that we know will only pass the House because the Senate doesn't have an appetite for the real underlying policy issue. But House members can go home with a campaign flyer to say, hey, we did this for you in Tallahassee. For example, one of them, there was a bill that looked at most favored nation pricing for prescription drugs. Of course, all of us on this call want a lower cost for patients to get the drug that keeps them healthy. It's just how do you go about getting that lower price? I think a lot of folks were afraid about availability of drugs. If all of a sudden Florida is the only state really in the nation that would have this low, most favored nation pricing, almost set pricing. And so the House, potentially will pass that. And they, like I said, they can go back and say in a campaign flyer that we pass something for you, our constituents, you, the voter, to lower drug prices. But it doesn't mean the Senate's going to act. I think they're share some of the concerns of how this would impact availability of drugs in Florida if our neighbors like Alabama, Mississippi, Georgia, wouldn't have the same kind of pricing mechanism. And I think a lot of people too are watching the federal government and some of the initiatives they have underway currently and how that would affect, say, in this scenario, the price of drugs and their negotiations with the drug manufacturers versus taking, say, a more extreme approach in which you'd price that in statute.
Wow, Fraser, real
Tony,
quick, I want to say that insight. We talk about a lot of the makeup of the House and the Senate, and we talk about more career backgrounds where a lot of lawyers, a lot of, business people, and not as many physicians, but we don't really talk about that generational gap where different ages mean different things. So, pretty good insight from Tony there. So, Fraser, any thoughts on that topic or future topics?
yeah, I was just going to say maybe the doctors are probably sitting back thinking, wow, how do generational differences impact the operation of a massive state government, right? But I think it highlights, Tony, the impact that leadership plays in the process, right? And how important those specific leaders are that you mentioned, their age differences and what sort of control or direction they have upon the agenda for everything that goes through the process. So you'll have some comments on kind of the top-down leadership role that has emerged in Tallahassee.
Yeah, for sure. And I think we've seen this since term limits kind of kicked in. And that is when you get to that last year or 2 years, your last, served for 6 years, you're down to those last two. It really means it's kind of like I think looking back at your life and you go, okay, what have I accomplished? It's the same thing when you're in year six. What have I accomplished? What do I still have to do? And so what you do see is these leaders then coming up with their agenda that they need the House or the Senate to carry out. They all have said, no, 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 this isn't top down. This is, the boots in the ground. They're making the decisions. I will say though, say in the House with 120 members, direction's kind of good. They do need direction of where they're going, or nothing tends to get, finalized. But in saying that, I think last session there did feel like there was more of a finger being pressed down on some of the, especially newer members. This year, there are a few huge initiatives that you feel that way with, but you'll notice mostly what's kind of making it to the finish line are the non-controversial issues, things that probably only the group that filed the bill really cares about, and they probably care a lot about that bill, but the rest of us are like, this is nothing sauce. It's okay. It won't affect us. I will say though, for doctors, I really have gotten the feeling this session that the old saying's true, that there's a tsunami out there brewing every time they're in session for those 60 days. And you're just bracing to make sure you have people like the three of us on this call watching what they're doing in Tallahassee, because you don't want that tsunami to hit. But that means a lot of times we do activate our membership and say, hey, please call or please reach out, because there is this proposal out there and they really do need to hear from you, the physician, how this would impact not only you, but your practices and also your patients. Sometimes too, it's inadvertent. They don't mean to cause harm, but when they're trying to help one group of people, it hurts the other. One example that came up this week was there's some issues still with PBMs. Remember 2 years ago, we did a big PBM reform bill, but the truth is these insurers, they're sneaky little, fellas. And they love to continue to wreak havoc. And what they're doing is using only their own affiliated pharmacies or specialty pharmacies and steering patients not only to those, but also reaping the benefits, right? They're picking where a patient has to get their drug simply for the most profit for them and not always even at the lowest price. And there was a proposal this week that inadvertently probably would have ended the buy and bill model in which many physicians use when they're infusing drugs in their office. Did the sponsor intend for that to happen? No, but simply by changing a definition of what a covered prescription drug is and saying it only applies if the drug is billed under pharmacy benefits. Well, any of our physicians on this call that buy and bill and bill under medical benefits for that drug for that patient would realize that, oh no, that might end the practice of buy and bill in the state, which would be huge, right? So sometimes it's also deciphering what's going on, making sure we're on top of looking at everything that shouldn't even have affected us, but inadvertently it would. So that's what we're here for, hopefully, to make sure the tsunami doesn't hit. And a lot of times it's to educate too, educate legislators on, oh, wait, let's step back a minute and let us educate you on how this could negatively impact. For example, people just needing to also get their chemo, right, in their oncologist's office, or somebody needing to get their osteoporosis infusion in their rheumatology office. Just any of those scenarios in which they wouldn't want to go back and have people not able to access that delivery model, but could, definitely not only impact it, but end that delivery model that patients are accustomed to.
Well, and that's a great insight into what's happening. And a lot of times people back home might see the headline and say, hey, I talked to this politician, 6 weeks ago. How are things changing so quickly? And that's kind of the story behind the scenes of what's happening. Toni, I want to look ahead to now with committee meetings running out. How much work remains, kind of looking forward as far as what happens now?
Well, the unique thing too is most of the first committees of reference, the real policy committees, aren't meeting anymore. But what that means is it's backloaded. So, for example, in the Senate, almost every single bill goes through Senate rules as its last stop and or fiscal policy. And so you're going to have very long all-day meetings in those committees. Like I think this week there's 40 bills, 40 plus bills up in Senate Rules Committee. Um, that also means that last committee chairman has a lot of power, right? Senate Rules, the Senator Passidomo, the past Senate president, she gets to decide what goes on the agenda. So there might have been some bills that made it all the way through until that last stop, but it doesn't align with what she thinks is good for, Floridians. And so it's that final stop. She's got a lot of pressure on her. There are some bills that, we're kind of happy she's kind of put the kibosh on for that last committee. In the House, they'll continue to meet a little bit longer, but same thing, you're hoping that if you have a bill, it's gone through, it's at least its first committee. There is those are the more the subcommittees. The big healthcare committee at the end will have really long agendas. It also means, though, some of the issues, if they're not going to make it in bills, they can make it in budget proviso. One of the examples I saw this week is there was a bill dealing with orthotics and prosthetics that would be important, say, for orthopedic surgeons, right? They use a lot of those devices on their patients that have injuries. That bill, though it's moving in one house, it's not moving in the other, but I saw some language on that issue in one of the budget bills. It's not typical, I would say, that things get just policy issues get pushed to budget, but when it is a funding issue, you will see that. You'll also see some unique things pop out in proviso language. And proviso language is not necessarily something you see ahead of time. And it just is a last minute, here's the language, it's going to affect, say, the whole Medicaid program or the whole FRAME program, which is, medical student loan repayment, or the whole disproportionate share program, which hospitals depend on for funding. So the budget is also a scary time because even though some of it's government in the sunshine, some of it is also you're going to just see some last minute language that pops out. The good thing is budget proviso is only intact for 1 year. So whatever's in there would only be a 1 year policy decision and not multi-year like when you change a state statute.
Oh, that's great insight, Toni. And you mentioned a number of bills as you were going through that. So if you would oblige us, we might ask you to look into your crystal ball a little bit just on specific bills that we've been talking about the first few weeks of session. We're not going to hold you to this. We are recording this so we can go back later and edit it out if you get any of these wrong, but we're going to ask you
Take a bet.
yeah, we're going to ask you a percentage chance you feel in your mind some of these bills have of actually passing both chambers and going to the governor. And of course, I'll start with the wrongful death bill that many of our doctors have been watching. What do you think its percentage chance of passing this year, both chambers and going to the governor?
I think we've done a really good job of getting our message across that if anything on wrongful death was going to pass, it needed to be coupled with a med mal cap for the House of Medicine. There's been numerous challenges just in the last, say, 6 months for the existing caps that are there on the Medicaid program and on emergency care. Because remember, those two still are in statute. You still have a med mal cap in those two scenarios. But the bigger House of Medicine cap was found unconstitutional by previous Supreme Court. So we have thrown out numerous times, if you pass something on wrongful death, it has to be coupled with reinstatement of some form of a cap. So I would say very low, just because they're not willing to entertain those caps. So I believe the House will go ahead and, they'll pass their bill. The Senate, I do not think will move forward with it. So it gives us more time to further discuss this summer, more look into what the courts are doing with, runaway jury verdicts too, when they are issuing or all are siding on the side of the patient. So stay tuned on that.
Great. And then I guess we can take scope of practice in a bucket or individually. Let's talk about them individually. There's two bills that have passed out. The independent passed out of the House. The independent autonomous practice for CRNAs and psychiatric nurses. You see the Senate having appetite for either one of those bills?
No, and I must say, in this scenario, the last scenario, I would say Senator Yarborough has really been a champion. Even though he's been the sponsor of the bill on the wrongful death before, he really understands the need for caps. So I'd say Senator Yarborough's been a real champion on the issue. So when you get to the scope of practice issue, Senator Burton has really been a hero on this issue. As chairman of Senate Health Policy, she hasn't heard any of these proposals. The naturopathic bill is the only one that she's put on her agenda with caveats. We will, though, see the bigger, what they're calling the big, beautiful bill. It's up in the House this week in its last committee stop. They're saying the House is claiming that their scope expansion bill, which is across the board, every single category for ARNPs to practice independently, they're saying it's based on the most recent rural healthcare grant awards that the federal government made to all the 50 states. All 50 states, of course, were competing for a very large sum of money in order to transform, I guess you would say, rural healthcare. But the grading of that was some very specific things. For example, Florida hasn't joined as many medical compacts as other states, so we lost some points there. So in that big, beautiful bill, I hate to use that term because I don't think we think it's very beautiful in some cases, but in that are two medical compacts, one for EMTs, I think the other's for PAs. But on top of that too, it also includes a scope of practice expansion because that's another area in which Florida lost points in the grading of the grant. The feds are saying that Florida isn't allowing practitioners to work to the highest of their ability. Ironically, I was on a call this week with some of my colleagues from other states, and they were saying in some of the states where there was a executive order that allowed, say, ARNPs to work independently during, say, these COVID years, now reviewing the data, they actually found that independent practice in their state meant less nurses available to do the job we actually need nurses to do, right? If everybody stayed in their lane, it doesn't mean we don't have a shortage, but at least we have the practitioners in place to hopefully address that shortage. But in those states, not only what happened was that the independent ARNPs went and practiced in medical spas, but they tended to also take the nurses that they worked with, say, in the emergency department or in their doctor's office, and also move those nurses to those medi spas. So it kind of mirrors the same data we're seeing here in Florida. The nurses aren't really wanting to go practice independently in rural areas of the state, but instead they not only don't want they want to stay in our urban areas, but then on top of that, they want to do more lucrative type nursing, which is the med spa, which under Florida law, they're not supposed to be doing. And under current Florida law, they are supposed to only be working in primary care. And I think there's a recent study as well from our physicians, one of our physicians here in Florida, that looks at how many of them are actually practicing outside that scope and really going to for the more lucrative type of arrangements versus really filling the void that we have out there in our in the number of physicians practicing. So I would say it'll pass the House. It's not going to pass the Senate, thankfully.
Nice. All right. And then what about our proactive insurance
I will say,
reform bills that we've tried to push? I think I know the answer already, but
yes. And I will say that uniquely, I had a much smaller proposal recently that was moving through the House, I mean, excuse me, in the Senate. And it was one little amendment to take care of one little thing. And you would think the sky was falling. So the insurers have done a really good job of fighting anytime we have something proactive. And the truth is, they're going to run out of ammunition sooner or later. And so sometimes as much as or how painful it is when our things don't pass, I think what we're all realizing is defense means you're going to have to just throw the bombs, and they're going to have to fight each one off, and sooner or later they're going to run out of their armor or their chits, right? And every time we discuss one of these, even if it's a smaller amendment and not the bigger piece of legislation, but the smaller amendments, what that does is continue to shine the light on insurers behaving badly. Insurers get to collect a very high premium from our patients monthly. And what they're not doing is passing on those dollars to the healthcare providers that are actually providing care. And whether it's downcoding or delaying care by, not timely authorizing prior auths, or, all the other barriers to care that they've put in place. And unfortunately, they place the physician kind of as the gatekeeper, the bad guy. When I say gatekeeper too, they're not really, right? They're just having to do all the paperwork to say, hey, I know this is what my patient needs. And then insurer's able to sit over here and just delay that care and treatment. And if it's your loved one, it makes a big difference, right? To get that care quickly. And honestly, to the physician too, I've started to say to legislators, part of the delay just requires more appointments. And if you're already saying we have a shortage, if you ask me what would help with the shortage, the provider shortage in Florida, it's to make sure that patient can move through the system as quickly as possible and get the care they need, because that means they don't need 10 appointments for what should have taken 1 or 2 appointments. So, messaging is really important. And I think sometimes we get caught up, especially on the scope of practice issue, on just talking about how much more education a physician has. But in reality, too, it's all about making sure our patients get the care, the timely care they need, and, the top tier care they need. And our physicians can deliver that, but the insurers need to get out of the way and let the doctors provide the care that keeps patients healthy.
yeah, so probably no reform coming
And
this
those
year,
are
but
probably
it's really
long-winded
important.
answers for.
No, you're right. No, it's great background. You added all that extra information about experience in other states, and really just a realistic strategy that we have to file those reform bills every year to let the legislators know these issues are ongoing. There more and more patients are experiencing. They've got family members experiencing the same challenges moving through the system too. So we just need to be consistent and continue to push for that reform. And hopefully their day of reckoning comes here at some point while Joe and I are still doing this podcast.
So true. And remember, next session, we'll have a brand new speaker and a brand new Senate president. And I'll thank all the doctors that are listening today, because they've done a really good job of making sure both those folks understand their practice, understand what their patients need. And I think we're going to see, a different legislature next year as far as supporting our doctors and what they do. So stay tuned on that. And I can't wait to sit with y'all next year after maybe midway through session, and we can look and see, kind of give it a report card. How are they doing? And that means, so we're going to be busy this summer in a big election year. That means we're out on the road. We're meeting with legislators. We're, delivering campaign checks. We want to make sure those members who support doctors and support the work we do are elected. And when we have folks like the insurers we just talked about on the other side, that means we'll be really busy making sure they hear our message loud and clear.
Great. Well, thanks for that. And the plug for what physicians can do back home in the coming months too, kind of building up to the elections. It's important that they're meeting the candidates, educating them on the process before they get to Tallahassee and can truly have impact on these bills as they move. So, Joe, any other questions for Toni here as we look to
No,
wrap the session?
yeah, I honestly think we covered a lot, and obviously it set the bar pretty high for us when we go back next week and we don't have Toni as our special guest. We're really gonna have to shine, just the two of us. But this was great. This really kind of set everything up for the kind of tail end of the session, and I just gotta say I appreciate Toni coming on and taking the time to give us this look behind the curtain, and it's really helpful. Obviously it kind of gets us going in the right direction. So thank you, Toni, for coming on. Any last thoughts, Fraser, or should we jump right into the musical tidbit for the day?
I think we do that. Toni, you may not notice, but every week Joe gives our audience of tens a music recommendation for something to carry them through the week until next time we get together. So I often spring different genres on him in the last minute. I did do that this week, Joe, but I did throw you a bit of a curveball. But hopefully you're ready for this musical selection.
Yeah, and I am. We were gonna do something different today, and I had one in my back pocket that was ready to go. This one was, I have to. It's not a band that's new. Everyone's probably heard of this band, but I had a dream a few years back that they're having a concert in between the new Capitol and the old Capitol over there in Tallahassee, and so I was like, I've got to mention them. But it's one of those bands that morphs over the years. Their original lead guitarist passed away from pancreatic cancer 20 plus years ago, and now their current lead guitarist is going through a similar health scare. So they have someone else kind of pitching in and playing their gigs for the time being. But it's Widespread Panic. The band's Widespread Panic, and one of the more recent songs is Little by Little. So it's kind of a good theme with legislature and kind of how it takes a while for things to happen, and you can't take big gigantic steps. A lot of times it's things happening little by little. So my tip for the week: put it on in your car as you're going to work, or as after you listen to this podcast. But Widespread Panic, Little by Little. I had a dream about it a few weeks ago, so I had to mention that band today.
Nice. And thanks for talking about littles too, because this is Parents Weekend. So as we close this for Toni, we appreciate you joining us today. I know it is right in the middle of Parents Weekend, and I know you're a proud parent of all those kids of yours as they're quickly growing up here. But we appreciate you taking the time to join us, and look forward to hearing your weekly updates for the rest of this year's session and then debriefing at the end of it all.
Perfect. My pleasure.
And I will say, Toni, you once told me that getting through the legislature is like giving birth, since we're talking about littles. And then after a period of time, then you forget about the trauma and everything that went through it. So, one final thought: how long do you think it's going to take for the trauma of this year's session to get by you?
You know what? I have been more optimistic this one, I must say.
Okay.
So, some are more painful than others. We've had some big victories so far. You know, it remember it's a war, so we got to get to the end of the war here. But yes, that is my number one saying though. If I remembered how painful every session would be, it would be like I would only have one kid instead of three. So
There you go. So hopefully weeks, not months, and that trauma will be gone.
yes.
Well, thanks very much, Toni and Joe. Appreciate it. This was a lot of fun. Look forward to doing it again next week, Joe.
All right, see you later, Fraser.
Bye.